Today's lesson will be a pharmacology review of adrenergic blockers. Hi everyone, welcome to my channel. I am the Nurse Doc Tutor Agent, and this channel is focused on helping you pass nursing school. This channel is focused on you getting those letters behind your name, whether it's RN or LPN. So go ahead and share with your classmates so you all can ace that exam. So first we need to discuss the role of your alpha-1 receptor. So an alpha-1 receptor is a receptor that is found on the surface of certain cells, mainly your blood vessels, your eyes, and your bladder. These receptors respond to norepinephrine and epinephrine. So when these hormones bind to alpha receptors, they can cause vasoconstriction, which is the blood vessels tighten, which increases the blood pressure, pupil dilation, which means that your eyes become more sensitive to light, contraction of your bladder muscles, which makes urination more difficult. A simple way to remember alpha-1 receptors is to think of it, this is your body's fight or flight hormones. So how does alpha-1 blockers work? So we just talked about what alpha-1 receptors do. So alpha-1 blockers are going to block the effects of alpha-1. So they block the adrenergic receptors in the blood vessels walls. So you remember we talked about these receptors that once they respond to adrenaline, they cause the vessels to tighten, right? They cause vasoconstriction. But in alpha-1 blockers, they block that response. So now we're going to see a relaxation, which is vasodilation of those blood vessels, which can improve blood flow and lower blood pressure. So here are a list of the common medications that is in this drug class. So you want to remember Zosyn on the end, and that is just a little trick to help you remember. So you have tamsulosin, we have doxazosine, and we have terazosin. So who would need to take this medication? Patients with high blood pressure, hypertension. So remember, your alpha blockers are going to cause vasodilation, which is relaxation and widening of the blood vessels, which will reduce the pressure on the heart and blood vessels, which will cause decreased blood pressure. All right. Also, patients, men with enlarged prostate, BPH. So that causes relaxation of the muscles in the prostate and the bladder neck, which makes it easier for patients to urinate. So what are some common side effects of this drug class? So the patient may complain of dizziness and lightheadedness. So remember, when you first take an alpha blocker, it can cause a sudden drop in blood pressure with this orthostatic hypotension. So when you stand up quickly, you start to feel dizzy and lightheaded. So how do we combat that? We want to have the patient to stand up slowly from a sitting or a lying position, and then we want them to sometimes even just sit on the side of the bed and dangle their feet. Just take some time before getting up. It can also cause headaches, and that's due to the vasodilation. So we want to let the patient know that these are some signs and symptoms that they couldn't see. Now, edema. Why would the patient have edema? So we want to think about it. So we have this increase in blood flow to the tissue, which can cause fluid to leak out the blood vessels and surrounding tissue. So remember that your blood vessels are now relaxed, right? So they're not contracting and all that kind of stuff to do. So we want to think like sometimes blood then can start to accumulate in these lower extremities. We also can have ejaculation problems with the men, which is retrograde ejaculation, where the ejaculation then, the sperm then goes to the bladder instead of going outside of the body. So it is important to let your patients know some of the signs and symptoms that they may see. Nursing interventions. So we want to make sure that we are monitoring the patient's blood pressure before we give the dose, okay? And then if the blood pressure is low, we want to notify the physician so that we can get an order to hold that medication or get the dosage changed. All right, safety is going to be big, you guys, because it can lead to dizziness and orthostatic hypotension. So we want to make sure that we have initiated fall precautions, but we want our patients to sit on the side of the bed and get up slowly before getting out of bed. We don't want them to just be jumping out of bed. We want to have them sit on the side of the bed, dangle their legs some, and then get up. You also want to decrease your salt intake because that can lead to hypertension. And also you want to assess for signs of fluid retention and edema. So we would then just check for swelling. Is it any pitting edema? We also can listen to their lung sounds to see, do we hear any fluid there? So these are some common interventions that we can do. So let's put what we learn into practice. The question says a patient with hypertension is prescribed an alpha blocker. Which of the following patient instructions is most important? Is it A, take this medication with food to avoid stomach upset? B, slowly rise from a seating or laying position? 3, avoid potassium-rich foods while on this medication? Or D, monitor your weight daily to detect weight loss? So, if you chose B, you are correct. So you remember this medication can cause orthostatic hypotension. A patient is prescribed tamsulosin, which is Flomax, for benign prostatic hyperplasia (BPH). Which statement by the patient indicates understanding? A, this medication will help shrink the size of my prostate. B, I need to take this medication at night to avoid dizziness. C, this medication will make it easier for me to urinate by relaxing my prostate and bladder muscles. Or D, I should avoid all dairy products while taking this medication. So, if you chose C, you are correct. A nurse is educating a patient with BPH who is prescribed Tarazine. Which statement by the patient requires correction? Is it A, this medication will help reduce my urinary urgency and frequency? B, I can stop this medication as soon as my symptoms improve? C, I may feel lightheaded when I first start this medication. Or D, I should avoid activities requiring alertness until I know how this medication affects me. So, if you chose B, you are correct. So, these patients should not abruptly stop taking the medications. So, these are normally long-term medications, and if the medication is to be stopped, that will be under the supervision of the provider. And that's a wrap. I hope you guys learned so much watching this video. If you enjoyed this video, please go ahead and subscribe if you haven't. Like, comment, and share with all your classmates. I will see you guys in the next video. I post videos every Monday and every Friday at noon. See you then.